management of stroke, which starts from the home, is the very important message I need to deliver here. The most important thing is how to come to know whether the patient is suffering from stroke or not. The common, very important syllable which we call is FAST, F-A-S-T. Face becomes crooked, one side of the arm becomes weak, speech is altered, and the T is for time. So the moment a patient suffers from these symptoms, it is a warning sign of a stroke or the patient is developing stroke. Now such patient, whoever seen, usually it is by the close relative or a kin who is nearby the patient, or the patient himself may identify this as a stroke symptom. The most important thing in this, in any stroke, is to take this patient for early treatment as soon as possible. So stroke treatment actually is not possible at home. It has to be done immediately within no time at a center which is eligible to treat stroke patients. That means the patient who develops stroke has to be transferred immediately to a stroke center, which usually is equipped with a CT scan or an MRI to confirm and diagnose a stroke, plus the team which has a stroke team with neurologist, neurophysician, interventional neuroradiologist, as well as patients or the centers which have cath labs. This is very important for these relatives to take these patients to a nearby center. Now, there are various ways of diagnosing this stroke. Most important is by a CT scan or a MRI. Two types of stroke exist. One is hemorrhagic stroke and more common is ischemic or blockage stroke. Now, in this situation, when there is an ischemic stroke where one of the vessel gets blocked and the brain supplying this vessel is devoid of circulation or does not get any food, and that brain starts dying. Now these neurons or brain cells which keep on dying, we need to revascularize or start the circulation as soon as possible, and that's why we say time is brain. So you have to act very fast. Once the patient or a relative develops a stroke, we need to be hospitalized, and then we diagnose the stroke by neuroimaging, that is by CT scan of the brain or MRI of the brain. And once it is confirmed that there is no bleeding and it is a ischemic stroke, we give two types of treatment. One is a medical line of treatment that's called as thrombolysis, which can be given, an injection is given once the patient's CT scan or MRI is done in a hospital, and the injection can be given within first 4.5 hours of onset of stroke. Now the second treatment is called as endovascular or angiographic treatment, wherein we go inside and directly go to the clot or the thrombus and remove the thrombus. It is done in an angiography lab or a suit called as a DSA, and with angiography we do this. So there are two types of treatment which has to be done within time. So first 4.5 hours, it is very important. The first symptom to 4.5 hours is the only window period where we can give thrombolysis or an injection to dissolve the clot in a ischemic stroke. While if the patients, or if there is a delay, or if there is a large blockage, we go in for a endovascular treatment, that is directly going by angiography in a cath lab and removing the clot mechanically. That is called as mechanical thrombectomy. So the most important message, once the patient has symptoms of stroke like FAST, face crookedness, arm weakness, and speech slurring or speech difficulty, these patients need to be hospitalized in the nearest center as soon as possible, so that the stroke treatment can be started as early as possible and the brain which is dying can be saved. This reduces overall the disability, that is post-stroke paralysis, as well as mortality, that's called as death after major strokes.